This was a retrospective review of health economic data collected in the United States, population-based data, and there was also data from clinical trial groups. And what it showed is that the outcome for folks and patients who were Black was poorer than the individuals who are Caucasian. And this is a complicated area, and the paper did have some methodological limitations. It had limitations because it was retrospective, it wasn't prospective. There were data gaps, and there were also quite large differences between the different data sets. But what this paper did do was it was a very large data set collected over a long period of time. And what it showed very clearly was that not only are there differences in access to treatment in the United States, treatment is often based on insurance, but even when patients had access, there were differences in outcome. Now, the part of the explanation was different genetic features of the AML in Black individuals as opposed to non-Black individuals, but they didn't account fully for the differences. And so therefore, this really speaks to 3 or 4 things. Firstly, that when collecting data, we should ensure that the data incorporates all ethnic populations, not just subsets of the populations. Secondly, there's really important issues around access. We need to make sure that patients have access to the best treatment and have access to clinical trials. The third issue is to collect not only the clinical data, as it were, but we really need to collect socioeconomic data. We need to collect data on the ability of patients to come to hospital, transport, availability of drugs, education, patient education, education of families. All these issues are really important when thinking about ensuring the best outcomes. And I guess the final thing is to ensure that the data that was published is studied in other countries and in other populations. So to ask the question, is this really validated? Is what the initial findings that were made, the initial observations made in the United States, are they relevant to other countries? So this then brings us to the question of how relevant this is to the United Kingdom. And I don't think we've had such a study in the United Kingdom. And I think such a study is timely for the United Kingdom.